I did. For the moment. Okay, I said slowly and deliberately. Let's get some bloods done. Full count plus everything else. Check for external injuries, especially on the head and neck. Set up vital signs monitors and we'll send him to CT as soon as we're happy he's stable. There must be a reason why he's unconscious. It was fairly unusual for someone to remain comatose for so long without any visible sign of trauma, especially someone who must have been walking around at the races earlier in the afternoon. But it was also unusual for someone's heart to beat 180 times per minute. A drug overdose came readily to mind, as did the possibility of a stroke or a brain tumour. The CT X-ray scan would indicate if it was one of those. My team of 2 nurses and a junior doctor set to work removing the man's clothing and connecting him to various monitors. One of the nurses inserted a cannula into a vein on the inside of his left elbow to draw some blood. Another shone a flashlight alternately into each of the man's eyes, watching for the pupils to react to the brightness. "Still no response on either side," she said. In a healthy person, the constricting of the pupils due to light is an involuntary reflex reaction. It happens without the individual having to think about it, and the lack of it in both eyes could indicate abnormally high pressure in the head or damage to the brainstem, but it could also be the result of having taken certain drugs, barbiturates, for example. "Ask the lab to specifically check for a drug overdose," I said to the nurse who was filling test tubes of blood from the cannula in the man's arm. "Can we also get a urine sample?" Seeking to discover what was wrong with the man was a bit like a murder mystery in an Agatha Christie novel, with me taking on the role of the detective. There were many possible suspects for the cause of his condition, and I had to determine the guilty one by eliminating each of the others in turn. I let my team do the intricate work while I stood back trying to take in the bigger picture. On the periphery of the group hovered a very young-looking uniformed policeman. "Can I help you?" I said. "I'm Dr. Rankin, Chris Rankin. I'm in charge of A&E this evening."
PC Filipos.
He instinctively put out a hand, but I didn't shake it because I was wearing sterile latex gloves. "Filipos," I said.
Yes.
He smiled.
Half Greek. I came in with your patient.
He waved a hand toward the man on the gurney.
The racecourse called us first. They thought he was drunk. It was me who called the ambulance.
I had wondered why it had taken so long for the man to get to the hospital. "Well done," I said to him.
What's wrong with him?
The policeman asked. "I'm not sure yet. We have to run some more tests, but I don't think he's drunk." There was a slight trace of alcohol on the man's breath, but not the usual overpoweringly sweet aroma of the unconscious drunk. I was well used to dealing with those on a Saturday night. We called them VIPs, very intoxicated persons. "Any idea who he is?" I asked.
None at all. I searched his pockets while waiting for the ambulance. All he had on him was £82 in cash and 1 crumpled bookmaker's betting slip. No cards, no wallet, no keys, nothing.
"He must have had a coat," I said. It was far too cold in mid-November to be at the races in only a thin shirt. The constable nodded.
He did, and a jacket and tie. I have them bagged up.
He lifted a clear plastic bag to show me.
Shall I take the rest of his clothes to add to it?
"He'll need them to go home in."
If he does go home,
the policeman said flatly. I glanced at him. "Do you know something I don't?"
No,
he said, but I wasn't sure if he was telling me the truth. One of the nurses interrupted us. "Dr. Rankin, we're ready for the CT." "Excuse me," I said to the policeman. "I have to go with the patient."
I'll wait here,
PC Filipos said with determination. I raised my eyebrows at him in surprise.
It's probably not necessary,
he said,
but I'll wait anyway. Then if he does come round, I'll be able to inform his family. He reminds me a bit of my dad, you know, in looks and the way he's dressed. I'd want someone to tell me if my dad was found unconscious in a racecourse restroom.
"You can wait in the relatives' room," I said. "There's a coffee machine in there."
Thanks.
The CT scan was clear. No visible clots or bleeds in the brain, and no tumour. More suspects had been eliminated. Now what? I began to feel shaky again.